Hi, I'm Tendai Chiware, a reproductive endocrinologist and infertility specialist, and welcome to my channel. Today I'm going to talk to you about what a normal cycle looks like. So looking at the pelvic organs, you have the ovaries, the fallopian tubes, and the uterus. So you are born with 1 million eggs inside the ovaries. By the time your period started, that number drops down to about 500,000 eggs. Every month, you're ovulating and releasing one egg, but you're actually losing around 200 to 500 of these little eggs inside the ovaries. And that's why most women will go through menopause when they get to their 50s, because they've used up all of these little eggs that are still inside the ovary through the years of ovulation or just losing those eggs every month. So if you're born with all of your eggs, by the time you get to about 35, usually around about 30% of those eggs start to have genetic abnormalities. And when we talk about the genetic abnormalities, I'm talking about the number of chromosomes inside the eggs. And so most people will know about one of the abnormalities, which is compatible with life, which is Down syndrome. In Down syndrome, there's an extra chromosome 21. There are other chromosome abnormalities where there are extra chromosomes or missing chromosomes, and a lot of these are actually not compatible with life, or if they are compatible, they may end in an early miscarriage or a miscarriage in the second or third trimester, or even sometimes a miscarriage after delivery. So around about the age of 40, over 50% of your eggs will be abnormal, unfortunately. And then between the ages of 43 to 45, 80 to 90% of the eggs are going to be abnormal. So we never actually know which ovulation, depending on what your age you are, will have a normal egg that's ovulated. And as I said, you only are ovulating one egg at a time, usually. Sometimes your brain may send enough message to get two eggs growing, and that's how sometimes people may have twins as well. These are usually non-identical twins. So that's how your brain will send enough message for you to have non-identical twins. So when the egg gets released, what happens is that your brain initially, when your period starts, around about day 3 or so, your brain sends a hormone to the ovaries called FSH, or follicle stimulating hormone. The ovary will usually then start growing those 200 to 500 eggs. Then around about the middle of the cycle, once your egg has been releasing enough estrogen, it sends a message to the brain to say, we've got a nice follicle that's a good size with a mature egg inside, let's ovulate it. So the brain then releases a hormone called LH, or luteinizing hormone. And LH will then tell the ovary to ovulate. The ovary usually responds to that message and ovulates 1 or 2 days afterwards. So when you're trying to get pregnant and you're doing ovulation testing or OPKs or LH testing, you're actually testing the hormone from the brain, LH, or luteinizing hormone, which is the message to tell the ovary to actually ovulate the egg. And as I say, the ovary usually takes 1 to 2 days to respond to that message to actually ovulate and release the egg. So when the egg gets released by the ovary, usually what happens is that that egg is then available for fertilization for 24 hours. After that 24 hours, it's no longer available for fertilization. So that's the ideal time for fertilization to happen, 1 to 2 days after that LH surge has happened. So usually when you're trying to get pregnant, I'll usually recommend that you start having intercourse every day for 3 days when you've had that LH surge happen. Sperm will usually come from the vagina into the cervix. Most of the sperm actually gets stuck in the cervix. Some of the sperm will trickle into the uterus, and then some will trickle into the tubes. So sperm can actually last about 2 to 5 days as opposed to the egg, which is only 24 hours. So we want to make sure there's enough sperm inside the uterus and in the tubes at the same time that that egg is available for fertilization in that 24-hour period. And so that's why, to make sure that there's a lot of sperm around, some people will actually start having intercourse every other day leading up into that high fertility time, or when that estrogen is rising from the growing follicle. And that sometimes with some of the ovulation tests will say that it's the high fertility period. And that's when you can start having intercourse every other day to build up those reserves of the sperm in the uterus and in the tubes. And then once you have the LH surge, I recommend intercourse every day for at least 3 days to make sure you cover that time period when the egg is actually ovulated, and that 24 hours when the egg is available for fertilization. Fertilization usually happens in the tubes, and so that's why it's important to make sure that at least one of your tubes is open when you're trying to get pregnant. So after fertilization occurs, then the tube will push the growing pregnancy through the tube back into the uterus, where it starts to implant as an embryo. And once that implantation happens and your vessels and the embryo's vessels start to join together, that's usually when you'll start to get a positive pregnancy test. And that can happen around about day 8 to day 12, even before you're supposed to have your missed period. So some of the early pregnancy tests will detect an early pregnancy as soon as that implantation process starts to happen, because the HCG hormone from the pregnancy is getting transferred into your bloodstream, that goes into the urine, and that's how you're able to detect it. But you can actually detect it a lot earlier with a blood test, and that tells us the actual level of the pregnancy hormone, and we watch as it increases at least 30 to 50% every 2 days. So to summarize, your brain sends a message called FSH, or follicle stimulating hormone, and 200 to 500 eggs start to develop. One of them becomes the dominant follicle, and then your brain releases LH, or luteinizing hormone, to cause ovulation of that dominant follicle. Progesterone gets released by the follicle that has ovulated the egg, and progesterone will then stay elevated if you get pregnant, and the corpus luteum, which is the follicle that had the egg in it, will continue to produce progesterone until the placenta develops around 8 weeks pregnancy. And then if you don't get pregnant, the progesterone level falls, and that's when a period gets induced by the drop in your progesterone level. So that's how a normal cycle occurs all the way through to implantation and pregnancy. I look forward to talking to you about more issues. Look out for more videos on my channel, and I'll see you soon.